I am Matt Varicki, and I am the CEO of the Jordan Elizabeth Harris Foundation. 75% of the people in Fort Worth who die by suicide never have contact with a doctor or a psychological professional. It's really important that we continue to expand our outreach to people who just are not getting the care that they need. And so we've begun to look at the workplace, at churches, and various other community events where people gather so that we can meet people where they're at and really provide this service in a much different way than we've ever thought of before.
So our partnership with the Jordan Elizabeth Harris Foundation has been a really important part of our staff care this year. I sat in on a training and learned about QPR, so question, persuade, refer, and was just so struck about how that would really be an important training to bring to our employees at Cook Children's. Healthcare workers are at 2 times the risk of completing suicide. Letting them know that their life is sacred is to bring this training to them so that they know that if they are experiencing a mental health crisis at work, that we are the safe people that they can come to. We've had 14 interventions where we've been able to talk to 14 of our employees that have been in crisis and get them the health care that they need.
As a Tarrant County probation officer, I currently work under a specialized program called the RISE program, working with women that are coming out of sexual trauma or abuse that are on for felony probation. This training was really helpful in terms of being able to address both at a professional level, but also at a client level of how to engage and be sensitive to red flags or warning signs. Personally, I've never had moments of suicidal thoughts or ideations until I walked through postpartum depression. There are moments where I've had to stop and buffer. As a professional, now I'm able to at least recognize how valuable it is at a personal level when working with clients. I think that QPR can be beneficial, not just at the probation level, but beyond that within the county and within the state and nation.
Specific to the Black community, the stigma that's been around regarding suicide really has been more of taboo. And so within our congregation, we handled it in a way, it was a little bit more casual until we were connected with the programs and just beginning to share with us about suicide prevention, recognizing it and acknowledging it.
One of the things that I think has been just really dramatic has been how people are responding to these trainings, which we're providing out within the community. These conversations change lives, and so we just have to be everywhere people are and meet them where they're at.
I want you to know that going through the process, not only was I extremely proud, but those who are in our congregation who also attended and went through the process was also awarded a certificate to prove that we went through the process and that we are now qualified. So we challenge each of you to go through the process and become a gatekeeper. You make a world of difference.
The most incredible thing we've seen is a 50% drop in youth suicides here in Tarrant County. We know that the programs that we offer help save lives, but when you get to the scale that we're at, covering 120,000 students across all of these schools, it can really start to make a difference. All of us for the last 20 years have been sitting around and just seeing these numbers go up and up and up and up every single year. And so to finally have a beachhead, to finally be at a position where we're starting to see this change, really has made all the difference, I think, for our team and for the people here in Tarrant County.
One thing that we noticed about our students is they really needed some help transitioning back to the traditional school setting. Some of the mental challenges that our students were experiencing, especially after they returned from remote learning and from being at home with their learning during COVID. I can think of one instance in which one of our Hope Squad members helped another student.
A friend once texted me. Even after he graduated, he told me he felt like the hard question, that he felt suicidal. I recalled back to the thoughts of the hotlines I suggested him, the strategies that I learned within the Hope Squad conferences.
One of my fellow teammates, she had seemed off for a couple of weeks, and I didn't really think too much about it, but one day she had posted something on social media. So I reached out and I talked to her, and she told me she felt suicidal, so I reached out to my counselors.
Many times our students are telling their peers when they have mental health challenges, and they're not always likely to go to an adult. And so I think it's important to train our students so that they can find these early warning signs, let them know what their peers are experiencing so that there's an adult that can reach out and help them.
The thing that surprised me the most about joining the Hope Squad was that they were super comfortable about talking about these hard topics.
I think it's important to talk to the kids as early as middle school because that's when it basically all starts. With the bullying, the different groups of people.
Talking about it more, it made me feel more comfortable to know that it's okay to not be okay.
We have incredible people here at JEHF, and the way that they've thought about approaching this problem here in Tarrant County gives me hope that it is ultimately solvable. I don't think that you can have a conversation about the Jordan Elizabeth Harris Foundation without talking about Jordan. And over again, I think that her story is really kind of the guiding light that explains everything that we do. We now have 120,000 kids that are covered. We have countless businesses. We have 40,000 people in this area who've been trained in suicide prevention. But we've got 5 people at this foundation who back us up each and every day and to make it so that they absolutely can eliminate suicide among themselves.